Question. A client on continuous heparin infusion for deep vein thrombosis, DVT, prophylaxis has an activated partial thromboplastin time, APTT, level of 120 seconds, therapeutic range 60 to 80. The patient is also receiving concurrent anticoagulation therapy with warfarin, and recent laboratory results show a platelet count of 110,000 per microliter, normal range, 150,000 to 400,000 per microliter. What should the nurse do next? A. Increase the heparin infusion rate and continue monitoring the platelet count. B. Decrease the heparin infusion rate, hold the warfarin dose, and notify the healthcare provider. C. Hold the heparin infusion, assess for signs of bleeding, and notify the provider for further evaluation. D. Discontinue the heparin infusion immediately, monitor the patient for bleeding, and initiate a thrombolytic therapy protocol. Answer. C. Hold the heparin infusion, assess for signs of bleeding, and notify the provider for further evaluation. Rationale. APTT levels above the therapeutic range indicate an increased risk of bleeding, which is further compounded by the patient's low platelet count. In this case, the nurse should withhold the heparin infusion, assess the patient for any signs or symptoms of bleeding, for example bruising, hematomas, or changes in mental status, and notify the healthcare provider for further assessment and management. Given the dual anticoagulation therapy, heparin and warfarin, the risk of bleeding is heightened. Immediate discontinuation of the heparin infusion and further evaluation are essential to prevent complications.